Welcome to eClinicalWorks podcast. I am your host, Marzia Fatima. On today's episode, we will be talking about eClinicalWorks Revenue Cycle Management as a Service. Here with me on the podcast today is Elizabeth Camacho from New England Community Medical Services. Liz, thank you so much for joining the podcast today.
You're welcome. It's a pleasure.
So why don't we start with your introduction and your organizations?
Sure. I'm the Director of Finance and Administration for New England Community Medical Services. We're a multi-specialty medical practice. We have over 50 providers that see patients in skilled nursing facilities as well as assisted living facilities.
Awesome. So your practice started with eClinicalWorks during COVID, but you've always been using eClinicalWorks' RCM services. What made you choose that?
Well, when we originally were looking for what type of software to use for an EHR, I noticed that with eClinical, they did have the integration with the RCM services. So you didn't have to log on to a different platform. It was a quick snapshot to see, currently what's going on with the practice, where the revenue is, on many different aspects, from provider visits as well as the revenue portion of it.
Amazing. Integration is definitely important, especially for admin, but also for end user, right? You're doing everything within the same software. You're not logging into 5 different places. So tell us a little bit about your access to analytics and reports when you use RCM services.
So there are easy access to the analytics and reports. There is some that it's just a matter of clicking on the tab and it gives you a bright screenshot of, year to date, this month, last month, in the last 90 days, which is nice to see, where the revenue is as far as where the provider visits are as well.
Can you mention some that you use very often or are integral to your billing department?
Oh, I use everything on the RCM tab. The provider visits, the dashboard that gives you a screenshot, as well as the console that lets you take a look to see any rejected claims. So you're not waiting for someone to send you that report. You can, if I have a new provider, I quickly look to see how are they coding, what was rejected, are they making mistakes, because they typically make mistakes, and then we can rectify it right away versus waiting for a billing team to send it to you a couple of weeks down the road before they create those bad habits.
So Liz, what about your revenue stream and your first pass acceptance rate? How's that going?
Wonderful. So our first pass acceptance rate is 99%, and the average days that were paid is 26. And that's a huge improvement from where it was before.
Yes. So I'm sure these reports also help you improve your SLAs and follow those optimized workflows that you have in your office.
Yes.
Tell us a little bit about how your workflows work in conjunction with these reports and SLAs.
So we have a very unique workflow. So we use Chromebooks with eClinical. We use the Chrome browser. We also use eClinical Mobile and eClinical Touch. So some providers like you are very familiar with all of them. And in the office here at our corporate office, we use eClinical in a Windows platform. So it is a little bit different. The providers utilize the eClinical Mobile portion of it the most, and they do enjoy that. I do have some that just prefer the iPad because it's a little bit larger. And as you get older, you need that little bit bigger of a screen, and they do use it quite a bit. They actually use the iPhone and the iPad more than they do their Chromebook.
Amazing.
Yeah.
This has been a lot of good information, and I'm glad that your practice is enjoying the RCM service. Thank you so much, Liz. We really appreciate you taking out the time. Don't forget to like our video and watch other podcasts on Spotify, Amazon Music, iTunes, YouTube, and eClinicalWorks.com. From eClinicalWorks podcast team, this is Marzia Fatima. Thank you so much for watching.